Good morning. On behalf of the Catoosa County Board of Commissioners, we'd like to welcome y'all. Thank you for being in Catoosa County. We'd like to thank our partners, Dade, Walker attendees, along with their CHI partners, the media. We would first like to extend condolences to the family of Alan Bradford, Dade County Commissioner, that had died of COVID yesterday. We'd like to remember him in our thoughts and prayers and ask that you would do the same. So far in Catoosa County, more than 20,000 vaccines have been distributed. That could not have been done without our partnerships with our Sheriff's Department, our school system, our cities, the city of Ringgold, city of Fort Oglethorpe, CHI partners, Department of Public Health, many partnerships. But as we get into the new phase, as you know, yesterday the governor announced we're opening Georgia all the way up for anyone 16 and older. So now we need to create more partnerships. So we'll have a regional partnership with Dade, Walker, and Catoosa, grouping together to attack this as a regional approach. A little over a year ago, we gathered together in a meeting as a regional approach and talked about what COVID means to our counties. Every step of the way, we work together to get through it together, which is what we need to do. So fortunately, we have great relationships with our state elected officials, Senator Jeff Mullis, House Representative Dwayne Hill, Chief of Staff Ryan Lowe, Governor Kemp, Dr. Toomey, Insurance Commissioner John King. I'm trying not to leave anybody out, because without these people, without them answering the phone when I called, we would not have the vaccines that we currently have. We went from struggling to get vaccines to now we have roughly 6,000 vaccines on hand at any given point in time, and now we're looking for people to give the vaccine to. So we ask for y'all's help in the media and the people watching to make sure that you let folks know that the vaccine is safe and that they can get it here in Catoosa County, along with Dade and Walker partnering together, and just pass the word that there is nothing wrong with this vaccine. We are very fortunate, very blessed to have it, and I want to get through COVID as quick as possible, and I think everybody else does too. So this is at the Colonnade, Catoosa County Colonnade. Most of y'all have been through. As you can see behind me, you have the vaccine line coming in. I think they called it the vaccination station. So they come in behind us, they go down, they sign in. We've got 3 lanes, sometimes 4 coming out. It takes about 15 minutes to get in and out, plus your waiting period. So we move people through pretty fast. Again, it's because of all the volunteers and all the partnerships that we have. So with that being said, we're going to pass the mic on to Shannon Whitfield, our Walker County Commissioner, and thank y'all for being here.
Hey, thank y'all for all being here today. It's great to be here in Catoosa County with our friends and neighbors, and we just have a phenomenal community. And speaking of that community, we lost a great one over in Dade County. Alan Bradford, Commissioner over there. He's been a great friend of mine over the last 5 years or so, and I want to extend condolences to him and his family. Very much a loss in our community. But as we come here today to help solve a great problem in our community of trying to get the vaccines out, you know, we are a great community, and Walker and Catoosa and Dade County work together on so many things. We were talking back in January about hoping to be able to get to this point very soon, once we were able to get more vaccinations, which has been a big help from Dr. Toomey down at the state, and also Dr. Vocio at our district office. Very much hats off to them for all the hard work and everything that they've done to help support us. We get a tremendous amount of support by our Senator Jeff Mullis and Representative Tarvin and Representative Cameron, and so this is truly a team effort, and we really come together as a community, and this allows us to have one central location where people can come and be vaccinated, get in and out very quickly. We all have people here on the ground representing all 3 counties to provide this service. We are pulling all of our resources together. We hope to be able to extend times of service in times to come, where hopefully we'll be able to do some late evening service and also maybe some Saturday or weekend vaccinations as well. So this is just a great day in Northwest Georgia. This vaccination station is a great collaboration of our community, and we're very thankful for all of our partners and appreciate all of y'all being here today, and we look forward to many more days of getting thousands of people vaccinated. We've had over 14,000 already vaccinated in Walker County, and the governor releasing where all adults will be able to get vaccinated starting tomorrow in the state of Georgia. This is incredible timing, and so we're all pulling together, and we want every adult in Northwest Georgia to get their vaccination as soon as possible, and this is the place to come. So we're very excited. Thank y'all for being here today, and look forward to a successful event. Thank you.
Good morning. I'm Ted Rumley, Commissioner in Dade County, County Chair. This is really a special day here for all three counties as far as us working together here on the vaccine. Shannon did mention there we really it's got a sad day in the county. Yesterday we lost Alan Bradford, one of my closest friends and the commissioners. Alan would he would be here today with me. So, but the vaccine, I want to stress in Dade County, our health department, we are still giving the vaccine through our health department. It's there's nothing changing in Dade County except we have teamed together here with our other counties here to make it more available to the people that are working in Chattanooga that normally, you know, they work and they get off at 5 o'clock, come home, and they don't have a chance to come by our health department. This is a blessing to everyone. If you can't really say that you don't have a place to get the vaccine, because here it is. We're close to Chattanooga. I had some people yesterday say, well, you know, we have to drive all the way around the mountain. No, we've got the health department in our county still going. This is to help people in the Chattanooga area that actually travel to work and back every day. But I just appreciate Shannon and Steve, our county chairs over here, with getting this together. It's just a great thing, and as you can see behind us, it's going smoothly. Our website, Carrie, she updates that regularly. It's very easy to get the numbers, the contact numbers to make the appointments. But I just appreciate everyone involved. Appreciate our law enforcement, our EMTs, our fire departments. That's what it's taken to make all this right here happen. So just appreciate everyone working. And please, you know, I have a lot of people say, you know, they're kind of leery about getting the shot, but really do your research, because you know this is this thing. The COVID is real. Trust me. I've still got people in our county that think it's just a phase. This is real. It's really hit home to us. You know, losing Alan, but I've seen several of the people in our county and in Catoosa and Walker also. People I've known all my life, and not young and old. You know, they're gone. So please take this seriously and take advantage of this opportunity that you have. And I appreciate everyone here. Appreciate the media doing this for us. Thank you.
As you all can see from this unified approach, the board, my board especially, Chuck Harris, Jeff Long, Benita Hollander, and Charlie Stevens' main goal is to vaccinate as many people as possible. It's also every desire from the commissioners and boards behind me. Earl Gray works every day out here, City of Fort Oglethorpe. So our main goal is vaccination right now. We feel like we have the key to see the light at the end of the tunnel, and we're ready to go through that. So if y'all have any questions at this time, we'll open it up. Thank y'all for being here again. Any questions for anyone? Yes, ma'am.
So we know that eligibility is changing Thursday for Georgia. Kind of what efforts are happening on the ground to address hesitancy and people who maybe are still unsure or uncertain about the vaccine?
Well, we're working right now to start getting some videos of some folks that are in the community, some well-known people, and if y'all have any suggestions, we'd appreciate that. To let people know that they've taken it, that everything's been fine. So we're going to try just a nice approach of just, you know, your neighbor took it. You know, let's talk to them, see how they like it. Local pastors, anybody that's willing to reach out and do a little tidbit, to holler at us, we'd be glad to get with them, Walker, Dade, or Catoosa, and let them know that it's safe. You know, I brought my 85-year-old mother took it, and I promise you if I wasn't confident in it, I wouldn't have brought her. She didn't have any problems at all. We've seen all the way up to 100-year-old here taking the vaccines. And to my knowledge, we haven't had any major incidents in the county. Does that help? Any other questions?
Steve, I was going to ask you, one of the challenges we face some days is some people cancel their appointment and don't show up for whatever reason.
Yes.
Life happens. What do you want to say to folks that once they sign up for an appointment on the online registration about just committing to that?
Yeah.
Because of the fact that could be a go-to to something else.
That's true. Well, I think a lot of the problem is, John, that people hear these horror stories that, oh, they ran out of vaccine. I've got to, I'm just going to get it wherever I can get it the quickest. But let me tell you, if we put your name down in Catoosa County, we will get you a shot. But that means when you sign up, your name is on that shot. And we want to make sure you're here because we can't waste it. At the end of the day, we don't want to throw anything away. We're going to find somebody to put it in. We literally one day got somebody walking their dog out here because we weren't going to waste a shot. So if you call in and put your name on a shot, please be here and let us give it to you because somebody wants it and we want to make sure they have it. Ma'am?
How many vaccines are you guys getting shipments in daily? Kind of what does that look like?
It comes in weekly. Normally you get your allotments on the first part, Monday, Tuesday, and Wednesday. This week alone, and another thing, doing with our regional approach with CHI Memorial helping us, Angela Hollander's behind me, Stiggins, she just got married, I forget that. With DPH, both DPHs, and we're also working with Delane Hunter with the North Georgia Healthcare. We have a lot of providers that are bringing their vaccines here. So just this week alone, we were able to get about 4,000 doses of vaccine. So then the challenge becomes getting the people here to get it in their arms. As you can see, our staff does a great job. This is the easy part. They do a wonderful job. We need people to come.
And just one follow-up question. So 4,000 vaccines this week, you need those people because they're not going to last that long, right?
Well, we have an ultra-cold freezer, so they will last. But once we thaw them, we have to use them. So we try to, we're methodical about it. We don't thaw them until we need them. But the quicker we can get them out, the quicker the state will send more. And then the quicker we can get through this. And our goal is to be through by summertime. So we need people to show up.
If someone cannot make it to their scheduled appointment, do they just have to go back to the process of going back online?
Yeah. Well, literally, you can go online now. We've got a new program out. You can get to it on any of our county Facebook pages or county websites, any of the three, along with the chambers. Chamber of Commerce is a huge asset to us, by the way. I miss them. Amy Jackson works hard for us. But you can literally go on the website now and change your appointment. You don't even have to call anymore. You can sign back in to the login, the appointment place, and change your appointment without even making a phone call. We try to make it as easy as possible so everybody can get in, get out.
Do you know the total number of vaccines that can be stored in the freezer here in Colonnade?
Oh, we can store. We bought a really nice freezer. It's the first time I ever spent $10,000 on a freezer. But I guess we'll go in the Dippin' Dot business later on, maybe. I don't know. But that it can store about 12,000. So we're in good shape.
Will this vaccination station take place of local vaccinations that are happening in local health departments? Or
No,
will they
ma'am.
still happen?
They'll still happen, especially in the Walker County area and Dade County, because our goal is to get people that's closer to this area. You still got Lafayette that's at the other end of the county. We want those folks to be taken care of as well. Dade County, you've got a lot of elderly that might not want to drive here, but as Ted said, you've got a lot of people live in Chattanooga that would love to be here. So it's just about making it convenient. If somebody's on the fence, a lot of times if they know they can get in and out in 10 minutes, they might jump off that fence. But if they think it's going to be a hurdle, they might not make the effort. So that's our goal, is just to make it convenient for everyone. Yes, ma'am.
Coming back to the idea of getting people to get shots, with regards to changing hearts and minds of people, are you guys doing anything to reach out to the communities that maybe are a little bit skeptical?
Yes, we've actually reached out to some of our churches and let them reach out to their populations. And so far, we've had, of course, we've got a bigger Indian population in our county that's not been apprehensive of it, and they're helping to spread the word as well. We would like to reach out a little more to our Latino communities, but as we get going a little bit more, now that we have a steady stream of vaccine, we can be a little more creative. Maybe we can go out to some areas and do some mobile vaccinations. We're here to do whatever it takes to get it done.
When are you guys looking at trying to expand vaccinations to evening hours and possibly Saturdays?
We're actually in the middle of doing a survey monkey right now. What hours would be best? And most people seem to be wanting a Saturday, so we're looking at doing that in the next couple of weeks. We actually run our Catoosa County Transaid to give shots, and I believe, Joe, you could probably answer this. I think Dade will do the same thing. Yeah. So, again, we try to take every obstacle away. We do twice a week now, but as demand changes, if we get more demand, we'll add more days. Nobody's back here shooting at me yet, are they? So, everybody's goal is to get it done as quick as possible. So if we have demand, we'll escalate the time frame, the days. Anything else?
The hours always be 11 to 4, or will they change and maybe be later hours?
They'll probably change. Again, that is another thing we're working on that survey, what benefits most people. As we get into a younger population, a lot of them are working more, different hours, different shifts, so we want to make it available to them as well, without them having to take off work. Any other questions? Wow, y'all are easy. Do y'all have anything for any of the other commissioners or mayor or anyone behind me? Yes, ma'am.
I have a question for Mr. Rumley.
Mr. Rumley?
Hi, Mr.
Yes.
Ridley. I'm Michelle with Channel 3. I'm sorry that you lost a very good friend. Can you talk a little bit about the fight Alan had in the hospital? Because I know it was a long time.
He actually had a really hard time. I mean, he was in my office the day before he started running a fever, and actually just had a little hoarseness. 2 days later, we were transporting him to the hospital. It moved his lungs. When he got there, he was on the ventilator off and on for a lengthy time. We did get a good report, the day before yesterday, before he passed away, that he was getting a little better from his wife. We talked to her, and then yesterday I was at one of our CETA meetings here in Chattanooga and got to where they called me and said he passed away. So he got a little better before he did pass away. And from what she told me and shared with me, he did recognize the family, recognize her, because he had been sedated real heavily before that. But it was a long go. He was in there. I'm not sure the days. I know he was in there. It was close to 90 days. It was 65, 70 days. He was in the hospital. So he'd been through a lot. He'd been through a whole lot. And Alan was tough. I mean, he was a healthy person. He was not. For those of you that know him, I mean, he's not a sickly person. I mean, he was out, in winter time, helping us, on the roads and stuff. He's not, so it's just a shock to us. We had really good hopes, that he was getting better and showing some sign. But that's what I say. This is not something to fool around with. The COVID's not. You've got a lot of the people, younger people especially, that are just taking it for granted, and and I actually, at first, I guess, I didn't take it for granted, but, there were so many unknowns, and there's still a lot of unknowns about it. But when you see somebody like him, and other people I know really was a healthy person, and it takes their life like that, it's something to really think about, Yeah. Any other questions? Okay.
Winston, did you have a question? Okay. I would like to address one thing. There's some folks on the social media, all of our friends, that are talking about people behind me not wearing a mask. And I want to say we're giving out a vaccine that is 95% protection from the virus, 94 and 95. I think Moderna's 94, Pfizer's 95. Everyone behind me has been vaccinated. That's one of the perks of getting your vaccine, is that the CDC has come out with their guidelines yesterday that you can be around people that's been vaccinated without wearing a mask. They've actually decided you can be around people without a mask around people that hadn't been vaccinated if they're not in one of the heightened states where they can get it easier. So there are perks to getting vaccinations. Our goal is to get back to a normal life. And I don't know about y'all, but I'm not a big fan of wearing a mask everywhere I go. We grew up thinking a mask, you was about to get robbed. So it's a different world for me. So part of the perk, part of the blessing of a vaccine is once we get through this, maybe we can live a normal life again. And I think we all want to get back to that. So for those that are upset that vaccinated people aren't wearing a mask, hey, you get a vaccination and maybe you won't have to wear yours either, because that's all of our goal. So, y'all got anything else? All right. Well, thank y'all for being here. It's a pleasure to have y'all.